So hello and welcome to the webinar on preventing separation and strengthening communities. Thank you for joining us today. My name is Richa and I work as the National Coordinator of India Alternative Care Network, IACN. Before we get into the sessions, I would like to take 5 minutes to set the context and give you a brief outline of the webinar today. So to begin with the brief context, all children have the need and right to grow in a safe and nurturing family environment. Yet across the world, children continue to be separated temporarily or permanently from their families. Research evidence and experiences of children demonstrate that children who grow up away from families and in institutions show long-term adverse outcomes. In many cases, family separation and recourse to alternative care can be avoided through the delivery of community-based social and family support services. A key challenge in many countries and contexts, including ours, is ensuring these services are available, accessible, and relevant to families at high risk of separation, particularly those located in remote and rural areas. Towards discussing some of these challenges, we have Hope and Homes for Children and CINI, who will share their work with communities as an approach to strengthening families and preventing institutionalization. Hope and Homes will also give us a global perspective on the same from the interventions in other countries with slightly similar contexts. CINI will also talk about their model on preventing separation and give us a case study from their work in Khuti in Jharkhand. Now to the outline of the webinar. We will try to finish the webinar within 1.5 hours. The first half an hour would be for sharing and the remaining half an hour for Q&A. We encourage you to ask questions to our panelists and make the webinar more interactive. Please use the Q&A box for your questions to the panelists. With that, I would now like to introduce the speakers for our first session. Otto Sestak, International Programs, Head of Learning and Engagement, Hope and Homes for Children. As Head of Learning and Engagement, Otto has worked in diverse international contexts around the world with a focus on capacity building and social workforce development in the areas of family strengthening, deinstitutionalization, systemic reform, and alternative care with a view to initiate systemic reform in childcare and protection, along with Mark Riley, Technical Lead India, Hope and Homes for Children. As Technical Lead on the Hope and Homes for Children programs in India, Mark provides project management and technical support working with UNICEF India, the Indian judiciary, local partners, and state governments. Mark has worked on developing a range of child protection and safeguarding policies, implementing strategies, and related training in South Asia and Africa. With that, I hand it over to Mark.
Thank you so much. I'm delighted to see everybody and so many colleagues and friends today. Very happy to be here. Before I hand over to the experts, I'm really just going to give a very brief introduction to Hope and Homes for Children. So everyone's aware, I'm very delighted and proud that our founders, Mark and Caroline Cook, are with us today. So very happy to see you and excited to find out what you think of our work in India. But of course, we are in contact with Mark and Caroline, who are very interested in everything that we are doing in India and in the Asian region. In terms of, for those who don't know much about Hope and Homes for Children, please do reach out for us for a more detailed discussion. We will leave contact details. But just to set the context for this webinar, Hope and Homes for Children work globally on what we call deinstitutionalization and care reform. In some contexts, we actually have offices in countries like Romania, and in other countries, we work through partners, in India, for example, and Nepal. We work with governments to really tackle the root causes of family breakdown. Why are children outside of parental care? Why do they end up in institutions? And we get to some of the root causes of those, working side by side with governments, NGOs, and different actors. We use deinstitutionalization as an entry point, really, to reform care systems and development of alternative care, family strengthening systems. We really are very ambitious in terms of wanting to see the elimination of orphanages. That is something that we all work towards. We understand that that's complex, and we understand all of the complexities of that, but that is our ambition, and ashamedly, that's our ambition, and we all work towards that cause, from everybody in HQ in the UK to all of our field workers and those of us working in different countries. We work with governments and civil societies. We work in over 30 countries in different contexts. We've been working in India since 2017. And thanks, Richa. If we just move on to a brief overview of our work in India. With the gracious support of the Oak Foundation, we've been working in India since 2017. We work with a local partner in Jharkhand called CINI, who you'll hear from today, who do some really tremendous work. I'm sure many of you are already aware of the work that CINI do. Our key objectives in India are really to strengthen the political will. So really to mobilize a lot of support around reforming the care systems and developing strategies. We're working with UNICEF as knowledge partners, helping around 10 states to develop care reform plans and strategies just by providing technical support, training, and we're also helping the alternative care network in India, part of our work with Richa, doing a number of things, helping to develop some material, running webinars, of course. And in Jharkhand in particular, the middle point there is we are really helping CINI and supporting CINI, our technical partner, to demonstrate effective care reform at community level. So you will hear today from our colleagues in CINI how that's working, and I'm sure you'll be really happy to hear some of the progress that we're making, and some of the challenges, and some work that really can be scaled up across Jharkhand and across other states. So that's a very brief introduction. As I said, please do reach out to us if you'd like a more detailed conversation with us. We are incredibly humbled and thankful to be able to support you guys in India on this care reform journey. And Otto, over to you. Thanks very much.
Thank you, Mark. Thank you, Richa. Good afternoon, everybody. It's very, very exciting to be part of such an initiative. I think it's the right moment to have a very serious conversation involving as many of us as possible on the issue of community strengthening and prevention. And it's even more important to do so as the world is experiencing this terrible, terrible pandemic that highlights so many of the gaps and so many of the fragilities of the childcare systems that we work with, trying to reform them and to improve them for the benefit of children. I want to start the discussion on community strengthening and prevention from the point of view of DI. DI is still, unfortunately, confused in many of the discourses with something which is not. In many cases, DI is viewed either as something very generic describing alternative care or a way of doing alternative care and only alternative care for children separated from their parents, or is limited or perceived in a very limited sense to closing institutions. And I just want to lay the foundation for our discussion by saying that, in fact, DI needs to be understood very, very holistically, because DI is all about creating a protective framework for families. It's about addressing their vulnerabilities and strengthening them and the communities around them. And it's called deinstitutionalization because it starts from institutions, from CCIs, as a starting point to backtrack vulnerable children to their families. And when we do so, we discover that these families are part of communities, and these communities all experience very similar vulnerabilities. So by going back from institutions, we find our ground zero for interventions. And our interventions should mainly be around family strengthening, preventing separation and preventing institutionalization, gatekeeping, and only then the development of alternative family-based forms of care. So simply rushing to close institution, in fact, creates a revolving door that puts children at heightened risk. When children are separated, and we see that this is happening in abundance, especially now during this pandemic, institutions should not become the solution. Institutions increase the incidence of abuse, neglect, and exploitation. They isolate even more children from their communities. So the solution is obviously in families and communities. This is where the investment needs to go. Solid gatekeeping, family strengthening and support, community development, so that all these allow communities to identify and to implement their own responses and their own services. So when we speak about trends in DI, we should really be referring to providing the necessary response to address any crisis while building strong mechanisms that prevent separation and institutionalization. Can we go to the next slide, please? So one of the questions that we start the process of DI from is, how are the families who end up separating from their children, how are they vulnerable? And we have seen in research that there are several common factors around separation and institutionalization of children. And they apply to any context with poverty as a red thread. We count among drivers of separation and institutionalization risk factors that are very common, such as unstable sources of income, marginalization, discrimination, disability, poor access to primary services, namely health, education, social benefits, poor family and social relationships, poor parenting skills, displacement, or the death of one or both parents. And it's easy to see how these vulnerabilities have been exacerbated during COVID-19 pandemic. Because beyond the health threat, the restrictions that were imposed to stop or to limit or to slow the pandemic transformed the risk factor I just mentioned into an endless list of emergencies. The vulnerable, who had been mostly ignored before the pandemic, were during the pandemic suddenly plunged into a deep and prolonged crisis. Their unstable income turned to no income, and no income meant losing the shelter or going hungry. Loss of income due to COVID has pushed millions into deeper poverty. Education, or access to education, was limited before, and it became very clear how it is further limited when systems fail. Children marginalized and discriminated when it comes to accessing education found themselves completely excluded from it in a very perverse manner. The online education that many schools promoted to increase and ensure participation, in fact, meant removing some of the kids from education, because online access means some living conditions that are at best a dream for some children who are at risk. Electricity, connectivity, technology are not even on the list when you're struggling to survive. Health and access to health went from precarious to dangerous. With very poor access to information, to supplies, to hygiene products, families found themselves very much exposed to risk and crisis. In addition, the pandemic filled the health system to the brim, and people with other health conditions than COVID were less and less able to access services and medication. Isolation meant more exposure to abuse and neglect. Even if isolation meant less exposure to frontline workers, it increased the incidence of abuse and neglect. The fear that came with isolation damaged even further relationships within families and with the surrounding communities. Children with disabilities or underlying health conditions found themselves especially vulnerable. And there was also a reduction in the normal protective services, the safeguards that we as society or system rely on for protecting children have been significantly reduced. So what we have seen in the pandemic was to see just how brutally fragile childcare systems are, especially when they're built around one or at least one major provider of service, and that is the orphanage, the CCI. Next slide, please, Richard. So when the system relies on one service, that is the orphanage, to provide responses to all and any type of risk factor, it creates a one-way highway. And there are several things happening. Children and their families become visible only when risk piles upon risk, and they turn into crisis. When this happens, or while this happens, there is no mechanism to allow for early or timely intervention, because the system is built to be mainly reactive, and it actually needs for the crisis to happen so that the system is able to roll out interventions. When children are finally noticed during crisis, when their well-being is threatened, the interventions that need to be put in place are many and are costly. And this makes it very, very hard to achieve rapid and positive changes. So as a result, children are separated and are placed in institutions. Even if this is done in the guise of emergency, such as, well, we need to feed them really fast, or we need to take them and place them in put them somewhere where they are fed. But when this happens, families are forgotten and ignored, and so are the communities where these families live. And needs are overlooked in such communities, and funding or resources, even when they're allocated in the form of social benefits and support, become too little, too late for families experiencing crisis. It's simply not enough to plug in all the gaps that appear in their family well-being. So families remain vulnerable and depend on social support schemes from now on. And this leads to generations, to a generational problem. Generation after generation is affected by the dependency on meager social benefits that are not enough. Poverty deepens, and families and communities find themselves slowly losing their ability to cope. And this leads to more families and more children affected by risk that turns into crisis. And finally, the state, who is supposed to support with social benefits, find themselves in a situation where no matter how much they direct towards social benefits, it's still not enough to cover all the needs and all the affecting risk factors. Next slide, please. So what is the solution? Well, one thing that we can learn from COVID is it pointed out very clearly what the gap is. There is a huge gap that affects interventions in the system. The limited, the poor, or the inexistent mechanisms and interventions at community level, and the over-reliance on institutions as providers of care. We have seen in the pandemic that when this happened, institutions either closed or discarded their residents, or isolated themselves even further and refused admissions. And they made themselves irrelevant. They did not live up to the purpose they claimed to have in providing services for children. And this is where DI comes in as a gateway to these vulnerable communities. And it teaches us that the crisis response at systemic level in the big picture should focus on the community level, preventing separation and institutionalization, making families stronger and more resilient, empowering communities to develop their own responses, and funneling resources to support what's happening in the community. So this is the game changer. This is the critical point of intervention. While backtracking from institution, the social workforce can easily identify and very precisely identify communities that are mostly affected by the risk factors. And this is made obvious by the fact that parents choose to separate from their children at scale. So these communities hold many similar families. Interventions can be tested and refined in such communities where the need is so obvious. There can be a very clear prioritization of need and of risk factors and of mechanisms and interventions to respond to them. These are the communities where we can set up gatekeeping mechanisms so that they can coordinate response to risk at the community level, so that we can refine a way to ensure that communities are given access to resources, but are made accountable for using them to respond to risk factor. And with such responses in place, the system can focus to deliver high quality, specialized services to respond to emergencies and to provide alternative care whenever this is necessary and appropriate. But the good thing is that the many risk-affected children will never have to leave their families and be placed in a residential system just to have sufficient food or shelter or access to education or protection from abuse. Can we go on to the next slide, please? So what can communities do? There's a number of community-led initiatives that can help communities achieve change. For instance, they can help with family support. And this may sound a lot more complicated and requiring a lot more capacity building than it actually does. In a number of communities that we work with in a number of countries, one significant and very underused resource in the community were grandparents. Grandparents who, with a little bit of help and a little bit of training, were able to provide a very, very needed and relevant service for children, especially for young children. Just by using their skills as grandparents, they were able to provide free daycare and early childhood interventions, making sure that children of young age who needed to be in a safe place did not need to be separated from their parents while their parents went to find jobs or to work or to bring home an income. Such very simple mechanisms can be highlighted in a number of communities and put to good work. Communities can be enrolled to help with the assessment, to focus on what strengths are there in the community and with families. They can help with assessing and designing interventions, such as looking out for children or initiate best practices for self-reliance or for family economy. For instance, in Rwanda, we have an example of a community that turned to intensive soy cultivation and using the crop to fight malnourishment, but also a lot of related activities such as counseling families with children at risk of malnutrition, developing cooking classes for young mothers, intensive farming and selling of the produce, a diversification of the uses of soy in terms of food stalls by the roadside, all bringing in income that was further invested in the development of community hub. Or another example where community volunteers were trained to look out for child protection issues and act within their mandate as community volunteers to counter risk factors. And these were mostly activities around raising awareness or acting proactively to prevent abuse and neglect occurring in families. Communities can also identify, leverage, and consolidate resources. It's very easy to set up a community mechanism that can be either formal or informal in its aspect. It's all about bringing together the most relevant community members, which must include representative of state functionaries at community level, community leaders, faith leaders, and volunteers who can help resolve community issues by sharing the accountability to respond to the needs identified in the community. So a good starting point for addressing many, many community issues is to start from the issue of child protection and care. And these are found in abundance in communities affected by separation. And it's easily discovered that they're not islands of needs, but they're part of varied and interconnected needs that affect families as a whole. So these agencies, whether formal or informal, can act and then request specific support for high-risk area to improve family well-being. Can we go on to the next slide, please? So we call them by many names: community or child development networks, district community mechanisms, community gatherings. They bear many, many names. And you will hear soon from our colleagues at CINI how they made use of such a mechanism. What do they do? When they're set up, they generate ownership and accountability within community. And this leads to long-term sustainability. And that means that communities become less and less dependent on external support. They also develop their own response mechanism, making use of the resources that exist in the system, but mostly of the resources they have available around them. While they include state functionaries, they can also make the system a little bit more flexible by channeling up the requests for high-risk areas to respond to high-risk areas and to deliver results. So they can essentially unlock the change in the system, shifting the focus away from massive and largely irrelevant residential care options to community responses. By developing a strong system of prevention and alternative care, and as such, sitting at the core of the new child protection system. Can we go to the next one, please? So these networks function mostly under two interconnected approaches. One, they can be center-based. Yeah, they can be nursery schools, daycare, preschool, children's centers, et cetera, et cetera. They then depend on an infrastructure, and they deliver services to children that mainly focus on some key areas like nutrition, education, stimulation in an integrated manner. Or they can be household-based, care provided in the child's homes, and they can take the form of outreach workers or mentors or community volunteers who provide parents or carers with basic skills and knowledge in child development, who can help build family resilience for a group of parents of carers, either through support groups or income generating activities. But they can also identify and advise on the use of emergency and long-term foster care, but also to link identified families at risk with service providers. And they do all this list of things that you see there: preventing family breakdown, preventing abandonment of children, provide a multidisciplinary approach and support to inform what decisions are necessary and when they're necessary, but also monitor and support children at risk in the community, including those who are placed back from institutions, creating a cycle of protection for children. Next slide, please. So all this functions in the work that we do across our countries with an action model. It's called Active Family Support. Active is an acronym that stands for appropriate intervention, community-based interventions, targeted or tailored to build on strength, delivering independence, bringing added value, and being effective in what they do. Support provided via the Active Family model is actually designing a strategic short-term support model that targets the individual needs of the child and the family and works on building on the strengths that family has so that it delivers significant changes in the 5 well-being domains essential for improvement, namely living conditions, family and social relationships, physical and mental health, including behavior, education, and household economies. All these domains are being looked at, assessed, risk is being assessed, and then interventions are designed to respond to all these risks. Next slide, please. Just to give you an idea of how this works, so far in the 2 quarters of 2021, by employing the Active Family Support, we managed to provide or to help over 3,000 children to prevent them from separating from their parents. Next slide, please. So how is this successful? Well, the social service providers who use this model act as a catalyst for leading a family out of crisis. They do this by using whatever financial and material resources exist in a very strategic way to deliver efficient results and efficient interventions. They advocate for the family in the spheres of social welfare, healthcare, housing, employment, education. And by doing so and using that community mechanism that just described, they unlock further resources that are needed to promote the skills and the confidence for safe and responsible parenting. The long-term integrity of each family is achieved by identifying and mobilizing a network of social connections, creating a web around the family that acts as a safety net for the future of the family. The ultimate goal of active family support is restoring and strengthening the social network, the family's attachment with the community, and overcoming the social exclusion of the family. Operating outside of the direct support for the family, which the surrounding community would give depending on the situation or need, mobilization of this kind of resource network unlocks the processes of strengthening social cohesion. By consolidating the support of the community, the results achieved can be sustained. And this kind of support goes far beyond the period of providing active family support. And it is measured far more in certain types of values, such as personal engagement, responsibility, and empathy, rather than material value. Next slide, please. Just a few examples to just put a little measurement around this. In Rwanda, the model for community strengthening and family strengthening by using the FS model allows for identification of clusters of needs, and it leads to the development of targeted services relevant for the entire community. That can be emergency support or community hubs, all delivered via this child development network that I mentioned, or community development network. They coordinate all the effort locally, and they're made up for all relevant authorities in the community and key community members and leaders. In numbers, in Q3, Rwanda reached up to over 5,000 total children and families supported. 455 supported through early childhood development at 5 community hubs, over 3,500 supported at home through income-generated activities, clubs, teenage mother support, physiotherapy, occupational therapy, and so on. In Rwanda, we were able to reach over 37,000 vulnerable children through the community development networks. And next slide, please. And another example comes from Bulgaria, where a similar mechanism, but called a district coordination mechanism, that we have set up in all districts as a model of collaborative gatekeeping system, that they are designed primarily for the closure of local institutions for babies. We started closing them in 2010 by adapting the DI model and including or focusing on this active family support provision via these mechanisms existing in local communities. So what this delivered was that the institution was replaced as a function by a center of social support funded by the state that incorporates the core values and practices of the family support model. This allowed us to influence the operations of existing centers of social support and scale up the DI program. We are currently in the process of eliminating all institutions for babies because they're not necessary anymore, and replacing the need for that they haven't, that they seem to possess in the community with community support and preventative programs. And we have managed to prevent over 350 children in 2021 in Bulgaria. Okay, thank you. Obviously open for questions, but over to you, Richa, and thank you all for listening.
Yeah, so thank you, Otto. We will take questions towards the end. With that, I would like to introduce our next speaker, Lopamudra Malik, Program Manager, Child Protection CINI. Lopa has over 15 years of experience in child rights and child protection with a master's degree in social work and a post-graduation diploma in child rights law. Lopa has worked across India on a wide range of child safeguarding and child protection projects in multiple contexts. Currently, she's leading child protection at CINI. With that, over to you, Lopa. Hello.
Yeah. So is my screen visible?
Yeah, we can see your screen.
Yeah. Thank you. Very good afternoon to everybody, and really privileged to be a part of this, this initiative. And thank you to my previous speakers, and thank you also very much for setting the context. Absolutely, you are correct when you say that COVID-19 pandemic has aggravated the existing vulnerabilities of the unprivileged sections of the society. And there has been a devastating impact absolutely on the children. It has pushed thousands and thousands of households into poor economic conditions, and that has had an adverse effect on child protection issues. We have seen hundreds of children getting into child labor, many parents getting their children married just to, reduce one amount at the family level. And child marriages have aggravated, and so is child labor. And it is very important to protect these children at the community level, because whenever they are at risk with their multiple vulnerabilities, the solution we only find is that of putting them into institutions when they gravitate away from home. So yes, thank you once again for setting the context. So in CINI, let me introduce you to our preventive child protection model. So this is CINI's preventive child protection model, within which preventing separation of children is embedded. It includes the adoption of mechanisms that reduce over-reliance on institutionalization, and it also enhances family-based care and alternative family-based care. And the overarching principle which guides this entire child protection approach is the best interest of the child, alongside the human rights principles of prevention, participation, accountability, and multi-sectoral convergence. Now, as you can see in this model has three logically interlinked levels, where at the primary prevention, the model aims to prevent the unnecessary and potentially damaging separation of these children from their families. So how do we do that? We do so by addressing the root causes of separation, such as poverty. As you can see, the pre-primary prevention drivers are written out there. So it's like poverty, gender discrimination, child abuse, trafficking, child labor, child marriage, limited access to education, and even limited access to resources and services, and coupled with poor parenting practices. At the secondary level, we find children who are already at risk. At risk to what? At risk to the violence against children issues. That is child marriage, child labor, child abuse, both online and offline. Here, the aim of the model is absolutely to prevent these at-risk children from entering institutional care. How can we do that? Well, we can do that by addressing the multiple vulnerabilities through multi-sectoral convergent actions, be it at the community level or be it at the systemic level. Lastly, at the tertiary prevention level, we usually get children whose rights have already been violated. They have gravitated all the way from the community to the institutions. So when we get children at the institutions, our absolutely aim is to prevent the re-victimization of the children who are already victimized, to prevent long-term institutional care. As we know, it has an adverse impact on the mental health of the children. And our focus is to expedite effective restoration and repatriation. Now, in today's discussion, the focus is on preventing separation. If we have to prevent family separation and retain the child within the safety net of the family, we have to work at two levels. So what are the two levels? One is at the local level where the child lives. So that is the community. It can be a railway platform. The child can live in a railway platform. It can be a street, a red light area, a bordering area, a remote rural location, or even an urban slum. And secondly, at the systemic level, where we need to work with the actors, with the relevant stakeholders within the juvenile justice system in India and also within the integrated child protection scheme. So what do we do? So what are our core actions at the local level of the child, that is where the child lives? So the first activity we do is hotspot mapping. Now, what is that? Well, hotspot mapping is conducted to identify social and geographical contexts with higher concentration of vulnerable children. So we usually do that through this social mapping exercise. After we've identified those zones, the next step is early identification of the total number of vulnerable children in the identified hotspot through digitized early identification tools. This is an innovation which we have piloted in Jharkhand as well as in the West Bengal chapter. We use these digital tools to identify the vulnerable children, and we form the cohort, because with the formation of the cohort, we can track each and every child at the individual level. So we have applied that across these two states. And definitely the effective case management, where each child's case is unique in its own way. So we have to have customized, tailored approaches in order to resolve their issues and bring them back to the safety net of the family. Second is linking the identified children with the existing government schemes and also family strengthening by facilitating the linkages with various government schemes and services. Now, what we have really noticed, see, in order to avail these government schemes and services, you require a host of documents. For example, in India, you need to have this Aadhaar card, the voter card, the ration card. If you want to have access to the disability scheme of the government, you also need to have a disability certificate. But we've seen that these children and their families usually do not have the required documents, and this creates a huge hindrance. So what does CINI do? CINI conducts these pre-linkage camps to help out with the documents, absolutely in coordination with the government counterparts, be it at the state level or be it at the district level. Secondly, I'll cite a very interesting example over here. In the case of mass restoration of 21 children, 21 adolescent boys who were being trafficked from Bihar for child labor, during the social investigation report preparation, we noticed that mothers of all these children, or their families rather, belonged to these economic poor backgrounds. And their mothers were not associated with the self-help program of the government, which actually is a part of their livelihood. So what did we do? We immediately communicated with Bihar Rural Livelihood Mission and initiated the linkages. The fourth block talks about counseling. Well, definitely counseling is an integral part of our entire process, which is conducted at the individual level of the child. Group counseling sessions are also held with them on a monthly basis, and the individual counseling sessions are on a weekly basis. And we also have these sessions with the parents. Now, when we say parents, it is not only the mothers, it is not only the grandmothers, but we also include the men, that is the fathers. Because still in India, in a patriarchal society, men are the key decision makers, whether we like it or not. Our fifth block talks about having these community-based safe spaces, and where we also form these children's group or children's collectives. So what are these community-based safe spaces? These are safe spaces for the children, where the children come, they can speak without being judgmental, they talk about their aspirations, their fear, their anxiety, what they want to do, the kind of vulnerability they are facing at the level of the family, even in school, and they try and find solutions. So we have such spaces across these two states. Last but not the least, we have to engage the three important pillars, that is the elected representatives. In India, we have the Panchayati Raj institution members, representatives, and at the urban level, we have the municipal corporations or the municipalities. Second, the service providers in the domains of education, protection, health, and nutrition, and the family and the community. Because these are the three pillars. With the engagement, we can absolutely create a child-friendly community. Now, these actions can lead to an outcome when it is supported by an effective mechanism. What is that mechanism? A strong follow-up mechanism should be in place. Now, this is usually done on a monthly basis, followed by a bi-monthly basis. But when we have really very, very critical cases, the follow-up, the first follow-up begins after the expiry of the first 15 days. With all the actions in place, the core actions in place, and a follow-up system, this can definitely lead to the formation, to the creation of child-friendly communities. The question can be, so what is a child-friendly community? Well, a child-friendly community is a community where children aged up to 18 years, irrespective of their socio-economic, culture, gender, ability, status, they are able to fulfill their rights in the domains of education, protection, health, and nutrition. Their right to survival, to protection, to participation and development is taken care of. It strengthens the partnership between the three pillars, which I just narrated a few minutes ago, and the children as well. So it basically helps to create a protective environment for children so that the children does not gravitate away from their families and fall into this vulnerable situation. Our next set of core actions is at a systemic level, where we talk about building the capacity of the frontline workers of the government. Here I'll cite an example. With this COVID pandemic in place, we saw some of the special category of the frontline workers of the government, they were really at dismay as to how to handle situations on the ground, because children were getting into child labor. There was rampant child early and forced marriage cases. They really did not know what to do at that point of time, whom to go to, how to address. So we conducted trainings for them. This is an ongoing process, but this is an example I cited where the demand came from these Anganwadi workers, where they told us, well, can you please orient us about these alarming situations, these alarming trends of child protection. And when we talk about this capacity building and we talk about the training of the frontline workers, it is usually, we train them on aspects of child and family welfare, on the various child protection issues, the child protection response mechanisms, good parenting, and the various forms of alternative care. We also conduct these sensitization drives, but not, alone. CINI does not do that. CINI does a lot of work in coordination with the government counterparts. So we do these sensitization drives in coordination with the SBCC cell of the government, that is the Social Behavior Change Communication cell of the government, and with the other departments, because multi-sectoral convergence is extremely important if you really want to address child protection issues. A lot of workshops are conducted with the JJ actors where you really need to hammer that why alternative care is important, how damaging is institutional care, and what will happen to a child when a child is placed in the care of their families. Networking, definitely networking is important because it helps to create a ecosystem, be it at the a district level, the state level, or even at the ward or at the Gram Panchayat level. We do so with other like-minded NGOs and with the interdepartmental counterparts. So I'll cite an example over here where we have formed these anti-trafficking networks in the North Bengal area in West Bengal. We have such networks in Jharkhand as well, and where not only like-minded NGOs, but the district child protection unit people, representatives from the special juvenile police unit and the anti-trafficking human units are also present over there. Last but not the least, CINI does not believe in erecting any parallel mechanism or coming up with any parallel option. If the government has a system, then our entire focus is on strengthening the evolving and the existing government system, and we can absolutely put forward value additions over there on improving its functionality. If all these actions are in place, then once again, this can really lead to the development of child-friendly systems. Now, the question can be, so what is a child-friendly system? What are you talking about? Well, a child-friendly system is a system which implies to influence policy frameworks. Policy frameworks within what? Policy frameworks within the juvenile justice system, the integrated child protection scheme, and the other related legislations and standard operating procedures which we have in India. So these are some photographs which I'm sharing with you from absolutely our field interventions. So where you have the photo of, the first photo is that of a social resource map. In the second photo, we see community ownership, community engagement, convergence, where the children and the community coming together to cull out the social resource map. The third photo talks about this particular community-based safe space in Kuti in Jharkhand, where you see the facilitator taking sessions. Then we have the RPF training conducted by CINI. The fifth photo is a very interesting and a very powerful photo. In a village like Kuti, we were able to create this football group where the girls were the footballers. And if you can see, the higher officials of the police had come to congratulate them. The next two photographs are also important in their way, where in the second last photograph, we've seen these community-based meeting taking place in the child protection committees. And then we have the male engagement, which is being focused over here, our facilitator going and having these parenting sessions with the male engagement. This is a sustainable impact. Why do we call so? Why do I call so? Because we can see the engagement between the duty bearers, the children, and the family. We can see how deeply the engagement is right from the planning stage. We see that the rights of the children are ensured, where everybody is taking, a role, playing a key role in that. And definitely, it is a very low-cost, preventive, sustainable model. Because in order to run a home, I think now it's almost around 40 lakhs per year you need to spend, whereas you need not spend that much money if you want to have a low-cost preventive intervention in place at the community level. Harvard FXP had conducted an evaluation of CINI's preventive approach to child protection in India, titled Before, Not After. It is available online, so you all can please have a look at the same. So through these interventions during the last 1 year, we reached out to 57,990 children. So what do I mean when I say we reached out to? Well, we identified and prevented these number of children from exploitative situations, and we could do so with the presence of 1,349 safe spaces across Jharkhand and West Bengal, 763 child protection committees across West Bengal and Jharkhand, and the 7 helpline services, that is the railway child line and our child line services in West Bengal. So now I'll just cite 2 very important and promising practices from the West Bengal chapter. So let me walk you through a very interesting case study where we see this 15-year-old girl named Fatima who lost her father due to COVID pandemic. Now she was there with her father, 2 sisters aged 4 years and 2.5 years, and 1 6-year-old brother. Little did she know, Fatima fell prey to aggravated penetrative sexual assault, and where you won't believe the father was the perpetrator. This was not once, but she was subjected to the same for quite a number of times. During our visits in the community and enlisting the number of semi-orphans and orphans, we got to know about the case. The community members informed us, and we immediately informed CINI partner Diamond Harbour Child Line. Over there, CINI assisted the existing family members to lodge a complaint. Because, for them, it is like, oh my God, the case is going to the police. The girl is going to get into a stigma. What will happen to the other children? So this issue of stigma is always there. But however, we spoke to the extended family members and we told them how important it is to lodge a complaint. And we did so. The family members did so. And we got the father arrested. Now, the entire family comprising of Fatima, who was a semi-orphan by that time, and her siblings were petrified. Fatima was very worried that her father would not spare the 2 younger sisters. And what happened, for a couple of hours in a day, their brother, that 6-year-old brother, went missing. He actually went to the market to sell guavas in order to feed their sisters, his sisters. We intervened and Fatima was transferred to a CCI for temporary shelter because she was traumatized. Her extended family members at that point of time could not handle her at all. She was provided intensive counseling support. to help her release her trauma, help her heal and recover. Because when we spoke to her, she said that, well, I want to get back to my sisters. I want to get back to my brother. I want to go back home. But she was so shaken up, she really did not know how to act upon it. We conducted the SIR. We developed the the individual child care plan. And with the reports and during the investigation, we found that the family members, the extended family members, were willing to take care of the child. And we put forward it before CWC, and CWC said in their report, the order, CWC mentioned no long-term institutional care. Institutional care was not recommended for them. And all these three little children, they were placed with their extended family member, with their uncle, in a kinship care arrangement. So this is how, through the community engagement, with the help of the CWC, with the help of Childline, with the help of the community members and the extended family members, we could retain the children in the care of their extended family and not send these children all the way up to the institutions. Our second promising practice is that of convergence, that is at the community level, which we saw when CINI, along with the Gram Panchayats at the community level, they decided of coming up with these child-friendly corners in three Gram Panchayats, named as Kalchini, Lankapara, and Tutturikanda in Alipurduar and Jalpaiguri district. So these two districts are part of the of North Bengal, of part of the 7 districts in North Bengal, and these are hilly regions. So what did we achieve out of that? Well, children who frequented these Gram Panchayat offices, especially the children and the adolescents, they had a space all for themselves, within this Gram Panchayat premise. And over there, when they came, they could talk to the Panchayat officials, they could talk to the Gram Pradhans. And we also started conducting these child protection committee meetings, which are supposed to be conducted on a monthly basis from these spaces. So these are some of the photographs. My God, there's a technical issue the moment I turn the camera on. Well, I'm really sorry, but I think my presentation, yes. So in the newspapers, this came up, where we can see that it was written about how these child-friendly corners were opened, with the help of government support in these areas. In this photograph, we also see the BDO and representatives, two representatives from the panchayats had come to open this. And this is a photograph of the child-friendly corner in that Gram Panchayat premise. So this brings me to the end of the overall CINI presentation and with the promising practices in West Bengal. I would really hand over this to Shubhodip, who will be highlighting some very important practices from the West Jharkhand chapter. Thank you very much.
Thank you, Lopa. Yeah, so our next speaker is Subhadeep Adhikari, a program manager, CINI. Subhadeep is a child protection specialist and professional social worker based in Jharkhand, India. Subhadeep has over 10 years experience working on a wide range of child protection projects across India. He is currently a project manager with CINI for the Family's First project in Jharkhand, India, and he would be sharing a case study from Khuti, Jharkhand. Over to you, Subhadeep.
Thank you, Risha. Just I'm sharing my screen. Is it visible?
Yeah, you can probably put it on the slide.
Yes. Is it okay now?
Yeah, fine.
Okay. So thank you, Richa, Lopadi, and Otto for this wonderful context setting and giving me the opportunity to share case studies from Jharkhand. A very good evening to all, and I'm delighted, extremely delighted to bring in some experiences from Khuti district, where we are working for the last couple of years, and sharing some of the experiences from field, which talks about family prevention, preventing family separation, and how it is complementing the CINI model as just shared by Lopadi in her presentation. So we are working in Khuti, and this case study is about a girl. Uh, right, it's not okay. So this case study is about a girl who is in the class of 9, was studying in class 9, and she was around 15 years of age, and her marriage was fixed by her parents and relatives. Uh, in Khuti, there is in this issue of this high prevalence of child marriage, child trafficking, and child labor. This is a district where it is performing fairly very low on the child protection indicators. So this is very rampant in the villages where we are working, where we often see that children get engaged into child labor or traffic or get into child marriage. So when this case got into our notice and we got to know that the marriage of the child has got fixed and she has no say in the family, she was dropped out, she got dropped out from school, she was taken out of school, and her education got discontinued. She was in crisis actually, because she had no one to in the family that will hear a voice or will understand her problem. So it was a forceful marriage that was about to happen, and she was not able to convince her parents that she is not in a position to get married. And she was very scared, of course, because she has no idea what the new life will be, where she'll be going. And the parents fixed a marriage because, again, it was a problem of, it's a girl child, so let's get rid of her. So the lesser the age will be, it will be less dowry that will have to be paid. So all these family conditions forcefully, have provided that, environment to get the child get married, and that's how she ended up in that vulnerable condition. So when she had no one in the family to share her condition, she brought this case to her friends and the adolescent group members with whom we are working in that community. So the adolescent group members got to know about this case, that one of the friend is getting married, and the adolescent group members in that community had a meeting among themselves. So these adolescent groups are those active girl members in that community who works on child protection issues in that community. So CINI present having a presence at the committee level, we work on these small committees, as was mentioned in the slides before, in developing the capacities of these institutions, adolescent groups, the village level child protection committees. We work in convergence with this village level institutions, where we can develop that ecosystem for providing the safety net in the community. So when that issue came up to the adolescent group members, and it was discussed among the group members that what can be done, how we can save that girl. So the adolescent members first, they tried to visit their family and made them understand. They made repeated visit to their family members and made to try to make them understand that this marriage should get stopped, and what are the pros and cons that can happen if she gets married. But again, the family didn't listen to them, and their efforts went in vain. And after that, these adolescent members brought up this case in the VLCPC committee meetings. So that's where the CD model comes into play, where we talks about convergence and working in a multi-stakeholder approach at community level, in developing that ecosystem, in developing that child-friendly communities. So the adolescent group members brought up this case in the VLCPC forum, and the case was discussed in the VLCPC meeting, and their plan was developed that how we can intervene the case and how we can make the parents or the family understand that this needs to be stopped. So joint visit was planned by the adolescent group members and the VLCPC members, and it took a lot of time to make them understand, to convince them. But since the VLCPC members are also from that same community, they have a familiarity, they know each other, so that push factor was not coming from within. Because somewhere down the line in the communities, it is a very normal trend that children get married when they are minors. So that push factor was not coming from the committee members that yes, this has to be get stopped. Though the VLCC members were trying enough, but that was not the best effort, and the families was not getting convinced. And then when this was not the case, so the VLCPC contacted the BDO and the DCPO of that district, I mean of Khuti, and they briefed the case about him, and they requested them for their intervention. So that's the systemic collaboration that we are talking about when we talk about the CINI model or the child protection model, where we bring in all the stakeholders from each level and we work together in collaboration in preventing these kind of issues and providing that safety net for the children. So when the DCPO and the BDO was informed, and the VLCPC gave them a written application that this kind of incidences is going to take place, we need to support. So the BDO and DCPO made joint visit to the community and to the family, and they made them understand on the consequences if this marriage takes place. And when a government official coming to a village in a community and meeting a family members, it creates a different impact actually, and that really helps in developing that awareness, in developing that sensitivity towards these kind of cases. So after repeated counseling and repeated visits, finally the marriage got stopped after couple of months of intervention. It is very easy for me to say in these 5-6 minutes that the marriage got stopped, but believe me, this was not like a very piece of cake that we went to the community and it was an overnight job that we convinced them. It required multiple visits, rounds of discussion. We worked with the parents on their parenting techniques, because family separation or family issues or unstable parental relationships has a lot to do on the parenting skills. So we need to work with the parents, we need to work with the peer groups in that community in developing that ecosystem. Also, when I say the marriage got stopped, it has to be monitored and it has to have a monitoring framework, follow-up mechanism, as was mentioned by Lopad in a slide, that we need to have a strong monitoring mechanism where we can say that yes, these many children has been prevented. So once the marriage got stopped, we supported the community in developing all those documentation formalities, where the child was restored back to school again. She was enrolled back to school, and she is now happy, doing very well, and in the family she is enjoying a very good bond with the family, and the case is being monitored on a monthly basis by the VLSBC members. So this case study is a very classic example where we say that with system convergence and community coming together in a multi-stakeholder approach, talking on the child protection issues, making multiple regular visits to the family and to the community, actually helps in bringing out that that mechanism for working on these child protection issues, and that actually helps in bringing the safety net and developing the ecosystem for the children. This is the picture where I was mentioning that the adolescent group members, they discussed on the case and they had a small meeting within them, and they raised the issue at the VLSPC forum, and the VLSPC members had a convergence meeting in the community where they talked on the case redressal, and they progressed accordingly. The next case study is also very interesting one, where we have seen that by building a strengthened child protection system, or by providing that system strengthening approach, working in the system strengthening approach actually helps in preventing family separation and providing that supportive role to the children. So this is a case of, again, a girl child who is from Kuti, and she lost her parents, both of her parents. The parents and this girl was in an unstable parental relationship, and somehow, because of some reason, both the parents passed away, leaving the child alone in the family, and no one to take care of the child. I mean, she was in just 13 years of age. She was studying in class 7, and she was actually had no place to go who can take care of the child. And the government FLW, the frontline workers of that community, suggested that let keep this child in a CCI. So institutions, they call in the local language as ashram. So the FLW said that let's put this child in an ashram, and she will get food, clothes, and shelter, and all. The education can continue, and she will get all the care. So let's keep this child in some ashram over here, and we'll be happy then. So this was the background, and from where we thought that if this is the case, and if this child gets to an institution, then the child development indicators or the overall well-being, as we say, that will get lost. We will not able to retain the child in the family. So why not explore what we have in our hand? And if there are any family members extended, or in kinship care, or someone in the community who can come forward and say that okay, I'll take care of this child. So when we discuss this case and when we put up the case in the VLCPC forum again, so the VLCPC members explored that what family options we have. And fortunately, we found a family, or extended family, who is residing in a different village through some of the local contacts. And when we explored that family, when we talk with that family member, so she happens to be the paternal auntie of this girl, and she's again alone. I mean, she has her own three biological children, and her husband again passed away, so she has very limited livelihood opportunities with no one to take care, I mean, no one to support her financially, and very limited livelihood opportunities. So she was in financial crisis, and she was eager to take back this child and provide that family love and care. But she was in dilemma that I have my own three children, how I'll be again managing another one with this limited financial options. So that was one hope that we got, that at least we have a family. Now we need to explore options of sustaining this displacement, and also supporting that providing the support system to the family, where she can be able to take care of this child. So as we talk about family placement, or when we talk about family based care, we need to keep in mind that family strengthening or providing that support to the family is very important to sustain any reintegration or to sustain any family based placements, because there has to be a proper plan when we say that we are placing a child with the family, because without proper family support, that reintegration or that family placement, whether it is in alternative care, kinship care, foster care, or whatever it is, that will not sustain, that will not go for long. So we need to have a dedicated plan when we have a family placement. So for this case also, again, we try to explore that what kind of support we can provide to the family, again involving system leaders and stakeholders, so that this placement is successful and this gets sustained. So the solution was that the VLCPC explored that what kind of family schemes, linkages the family is getting, and what kind of additional support we can provide by providing that family linkages. So the VLCPC provided that linkage support with the block officials and filed an application for linking, for getting a linkage support from the DCPU for sponsorship. So that child has been placed in kinship care, and if she gets enrolled with a sponsorship scheme as per the alternative care guidelines, so then that support, that financial aid will help the family for an overall well-being development of that child, and also the family will be sustained in terms of continuing the regular expenses, because the VLCPC has also provided that application to the block office for family linkages. So this is the practice, and this is the environment ecosystem that we're trying to build at community level, where these community level institutions are empowered to take decision for active case management, and proposing local solutions, where family strengthening plays a very important role, preventing family separation, providing that counseling support to the family and the child is very important when we talk about community gatekeeping. So the VLCPC filed an application for sponsorship linkage. The case was presented in the DCPU meetings by the VLCPC. The DCPU officials made a field visit to the family for an assessment of the case, and when they were satisfied with the case background and the documentation and all, it was discussed in the SFCSC committee meeting at the district, and finally the family and that particular child got linked with the sponsorship scheme. So again, the family is doing very well. The child has been well gelled up with her paternal auntie, and this is a very unique case, I would say, because this girl was there was all possibility that she would have end up in either trafficked or child marriage or child labor, or at the last the worst scenario would have been that she ends up in child care institutions. But bringing all these stakeholders at one place, working together in collaboration, exploring options of family placements, and providing that ecosystem to the child, bringing the stakeholders of at district level, at the community. So we explored an option through which we can say that yes, this case has been prevented from getting separated, from getting separation, and we have provided that family support. So these two case studies from my side, I would like to I presented in front of this forum, And that's how the CINI model plays a very important role in developing that community level child protection mechanism, child friendly communities, and also child friendly system where both of them work together in collaboration in bringing all these stakeholders at one place and developing that ecosystem for child. So these are some of the photographs. The child is being supported at home by her paternal auntie in education, food and all. Out of the sponsorship money, this paternal and this auntie brought her a cycle so that she can continue education and get back to school again. And the DCPU representative is making a visit to the family for the assessment and for the sponsorship linkage. That brings me to the end of my presentation. Thank you so much for the patient hearing, and that's all from my side. Thank you once again. I would now request Richa and the moderator to open the floor for questions and answers, if any. Thank you once again.
So thank you, Subhadeep. So with that, I think we can take up questions. So there were a few questions in the Q&A box, and we had also received a couple of questions. So maybe we can begin with this question that maybe Lopa can answer. So Lopa, you were mentioning about how in your community-led initiative, you're also working with the menfolk in the communities. So somebody had asked about this, that, what are the challenges that you face in getting male members of the community involved, and how do you address and navigate those challenges? So if you could talk about, like, giving specific examples. Slopa, you are on mute.
So engaging the male members is really very important. So you will never find them if you tell them, well, we have a particular session on this particular day, and if you can really make it. They are all busy with their livelihood, and especially with the onset of the pandemic, they will never ever come on the day or the time which you are allocating, but rather it is like we reach out to them, we go and tell them and take a session in a probably not in a very structured manner, but we tell them the important thing is to send across the key message. So the one challenge we face is getting them all together if we really want that. So it's better you reach out to them. And then when we reach out to them in a collective manner where, they are working, probably we go there and talk to the employers and, okay, if we can during the lunch hours, can we have a little time? Can we have a chat with you all? Well, then they really give you that time. And then absolutely at the individual level of the family, we conduct the follow-ups and then we talk to them again.
And also, Lopa, talking about how children's issues are often seen as women's issues, like parenting is something that especially men in India are not very involved with. So, in terms of that, how do you address that, or how are you trying to break that barrier?
So where we see that, the involvement of men is absolutely, in terms of decision making. Okay, they want to get the control and they want to be the key decision makers. But when it falls to the child, it's like the mother has to take care. And if, there is some kind of a vulnerability issue, it's because of the mother often. But that husband or the father will never say it's because of me. So over there, this was a classic example which I cited purposefully in the presentation, because when we saw that the girl was being sexually assaulted day after day, and she did not disclose at the beginning. So when we told them that, well, the father is the perpetrator, the immediate reaction of the community was, but if the father goes, who will take care of the child? The child becomes an orphan, the mother has died, and the father probably has done so because he's frustrated and he's just venting out his frustration. But let us talk to him, we'll console him, we'll make him understand. But you really cannot let that happen. So we engage the community over here. And if you see the paternal uncle over there who's taken this kingship care bit, that was the paternal uncle. And we said, suppose instead, if that was the mother, would you have forgiven the mother? If that mother had brutally beaten up the child, would you say the same thing? You would not. You would say, well, she is a victim of this and that's why she does so. She has behavioral issues, so on and so forth. You would have never said that. So think about it in that manner. So if this father has committed a crime, a heinous crime, he has to be put behind bars. So this is one such example in which way we have tried to address this gender bit, because it's usually when it is done by the mother, it is like, oh well, she's a homemaker and she's just venting out her frustration. She doesn't know what to do this. But with the father, the angle is of protection. So this is a way in which we really try and address the issue. And a second thing is, when this decision of marriage comes, during the pandemic, we really saw a lot of children getting in, becoming victims of the marriage. We always saw the father taking the decision, because for them it was, it is one less mouth to feed. So please send them. And there we told the father that you are sending the child away so that one mouth reduces. What about when the child comes back as a victim of domestic violence? How would you address that? And when they come back with a huge quantum of vulnerable issues, what do you do that? Have you discussed it with your wife? What is good for the child? What does she need? Have you discussed it with your daughter as well? So these are in some examples of how we try and address it.
All right, thank you. So there was also a question on kinship cares, especially what is the kind of follow-up mechanism, monitoring mechanism that you follow with regard to cases of kinship care. So if anybody from CINI would like to answer that.
I got a specific question related to Fatima, where she wanted to understand that how we are conducting the follow-up. Now, initially, not with Fatima, with the children who are placed in kinship care. So it was like 15 days because it was a very critical case. So within the first 15 days, we conducted the first follow-up. Then this case is absolutely referred to the Child Protection Committee, that is the village level Child Protection Committee. So we have engaged them as well. So on a monthly basis, the ASHA workers, the Anganwadi workers, they visit and they do the follow-up. Because if you also look at from a sustainable point of view, it is also important to engage the government counterparts over there. But it's not that CINI has washed up the hands and CINI does not do anything. No, CINI is part of that follow-up team, and CINI outreach workers, our outreach workers, frontline workers in the field accompanies the ASHA workers and the Anganwadi workers to go and conduct the follow-ups.
Yeah, Otto. You are on mute. Yeah.
I realized that as I was starting to speak, sorry. I just wanted to add a little bit to this guaranteeing the safety of children in kinship care. And it's a very legit question because institutions provide that illusion that children, because they're in a confined place, that has a very specific location and sometimes even CCTV cameras, are actually very safe and ensure the safety of the children. When in fact, exactly the opposite happens. Because they're so enclosed and so isolated from the public scrutiny, so to say, from the public eye, from everybody in the community seeing, it actually allows, it transforms into an environment where abusers can actually thrive. Even with the CCTV cameras and all the procedures and the unannounced inspections and all the mechanisms to monitor, in fact, that creates a routine that can be easily bypassed, which doesn't happen in the community. It's true, in the community, you don't have a fixed location for these guys, for the kin looking after children. You don't know if you go at one point, if you find them at home or not. You have no way of seeing what they're doing on a daily basis with the child. What you do have as a professional, and it takes a little bit of shifting your thinking process, is you have the community that can act in this respect to provide all this extra information that you need for a proper monitoring. And sometimes even for intervention and slight correction of things that might happen in a house, in a household. Yeah, and this is a very, very important resource that should be incorporated in all the monitoring processes that you do with the family and the child, to have the community involved and accountable for the safety of the child. so that they can always keep an eye on what is happening there without this becoming into, a spying session on the family, people looking in, in their windows and what they're doing at home, but just, making the community aware and available and accountable for what is happening in the community. Therefore, you increase the chances of reducing incidents of abuse and neglect, which will never happen in a CCI with all the surveillance that you can set up.
Right. Thank you, Otto. So the next question, probably Lopa or Subhadip, one of you can answer. That it says that how the landscape, how resources are critical for family strengthening. And as you know, in communities where we work, sometimes resources may be very limited. So in that case, how do you ensure like referral through, what are the pathways for linking families to services that they require, that address their needs and vulnerabilities?
May I just respond to this? Then Lopati, perhaps you can add on
Yeah, go
from
ahead.
West Bengal.
Yeah.
Yeah. So that's the, that is the advocacy part that we are trying to, bring up through this program implementation, that we need to redirect the expenses or the investment from, institutions towards community, because that is the place where we need to strengthen and develop the child protection safety net and build up these institutions. So as far as this question is concerned, how we are supporting the families in strengthening and financial what kind of possibilities we have. So as of now in the current framework, if we see, so the only option that we have to link families and to make them sustain or financially independent is through linking with the existing government social norms and the welfare scheme that we have, from whether it is health or education or livelihood or any kind of other assistance that comes up from the district level. Because apart from that, there is no additional resources that has been parked for families who are in crisis situation. Neither as an organization we can promote that practice that CINI is providing or parking some kind of financial resources for families, because that's not a sustainable or long-term approach. So in the current framework, that is the only area where we are advocating that we need to develop a very robust linkage mechanism that talks about the ICPS framework as well, where the VLCPC, the block level child protection committee and the district level child protection committee will work in collaboration and will promote these families for linking and support them in this kind, reducing the vulnerabilities. And that's the advocacy we are trying to bring in, where we are influencing the district advocacy for budgeting some kind of resources at the district level for community intervention programs. We have a very good program in West Bengal that is going on, which Lopadi might give us some more light. That is, we are working at the panchayat level for on child budgeting. So we have empowered panchayats where they are parking resources for developing child protection plans and implementing programs at the panchayat level, and having those kind of financial assistance at the panchayat level, because there is some kind of funds that comes to the panchayat and the PRI department is liable for utilizing those funds, and most of the funds gets utilized for building roads, boundaries, water tanks or ponds, etc. So we have a very less scope in developing programs for child protection and developing some kind of financial assistance for these kind of families and children. So that's an advocacy, that's the change we have brought in West Bengal through advocacy and continuous value addition technical support, where the gram panchayats now are developing child protection plans, and the children has a say to it. So that is a child budgeting that we say, where children come up with their own plans and have a dedicated budget for that. So that's the scenario as of now where we are trying to advocate and bring in change. Lopadi, if you can also add on from your experiences to this.
I think you've said it all about the child budgeting piece, definitely, where the children tell, during these Gram Panchayat level meetings, where they talk about the kind of support they require, the kind of vulnerabilities which gets flagged during these meetings at the community level. We route them through the GPDP plan, that's the Gram Panchayat Development Plan. And over there, the children participate in order to call out that child budgeting piece. So this is the quantum of money which is required for, these many children for that purpose. Another very interesting aspect to note over here is, during this pandemic and with the second wave, we saw a lot of children becoming orphans and semi-orphans. Now, you have to understand the district sponsorship foster care approval committee has a specific budget of only 10 lakhs. So with 10 lakhs at the rate of 2,000 rupees per month for a year, you can only support 41 children. Now, there are not only 41 children in the community, right? There are more than that. So this was a piece of advocacy issue where we partnered with the district, and these letters were sent at the state level for allocating more funds. That if because these many children have been identified who are orphans, who become semi-orphans, and they require that support. So yes, we have done that. Another thing we've done, when we saw that the funds at the district level were becoming exhausted, we referred those cases at the Gram Panchayat level, and we routed them through this GPDP, we routed them through this child budgeting, and we linked them with the two Upasamitis, which are very important within the Gram Panchayat system. One is for education and health, and the other is for your family and children welfare, where they have allocation of such funds. So we linked those cases with these children.
Yeah.
And the third part is another very interesting thing, that we have seen children and families who live far off from the district headquarters or even from the services, And very recently, the government in West Bengal has announced a host of schemes, starting from, calling as Lokhi Bhandar and Shasto Shati. These are health-related schemes and these financial assistance schemes. So in order to avail those schemes, what we did, we had these pre-linkage camps at the place where the families were located. Because there's no point in traveling 180 kilometers or 160 kilometers, come and get yourself registered and, do this. So we took that entire thing at the doorsteps of these families at the community level where they were, in order to set up these family linkage camps.
So thank you, Lopa. We will take one more question, which I thought was very important. So somebody has asked, Muzammil has asked that apart from the counseling sessions, how do we ensure a sustained mental health and psychosocial support in the child protection mechanism, which is to say that most often a mental health expert may not be needed. Sometimes, what is essential and needed is to promote positive behaviors for positive mental health. So in that case, how do you promote sustained mental health support and psychosocial support in communities?
So CINI has a teen line, an exclusive teen line services for the adolescents, who come up with a lot of issues related to their, sexually reproductive health rights, and a lot of their personal issues they come up with. So we have this toll-free number titled Teen Line for them. And we have these sessions with these teenagers or with these adolescents on mental health. You're absolutely correct that you need not always have a very trained expert in order to take care of these aspects. So what we do, we create this cadre of first level counselors or the barefoot counselors, where we give them this simple training on how to conduct first level counseling sessions, or just take care of the problems which they get to know about. And if the case is extremely critical, then definitely escalating the case and referring the case at the higher levels.
All right. Thank you, Lopa. So with that, we come to the end of the session. Before we end, I would just like to mention about this BICON conference that is happening on 8th and 9th of December. So BICON is a conference on which discusses about the rights of children without parental care or at risk of separation. And this year, the focus area is Asia. Asia, and many organizations have come together to organize the consultation. Hope and Homes is one, and Udayan Care from India is one of the organizers. So I think you will find the link to BICON conference in the chat box. So please do check out the link to BICON and register, participate for more learning, for more discussions across different countries in Asia. And with that, I would like to thank you all for taking the time out and joining and making this webinar more participatory. Thanks also to all the panelists for their great insight and presentations. And thank you especially to Mark from Hope and Homes in helping with organizing this webinar today. So thank you all, and please check out our website www.iacn.in and register on the website to receive updates and our quarterly newsletter. Thank you all.
Thank you.
Thank you.